Shash USMLE style question. A 68-year-old man presents to the clinic with a 6-month history of difficulty walking, muscle stiffness, and tremors. His wife reports that he has developed a shuffling gait and often appears to have frozen episodes where he cannot move. He also complains of a resting tremor in his hands, which is most noticeable when he is relaxed. On examination, the patient is noted to have rigidity, cogwheel type, and bradykinesia. His speech is slightly monotonic, and his facial expression is masked. His medical history is significant for mild cognitive decline. Which of the following is the most likely underlying pathophysiology of this patient's condition? A. Loss of dopaminergic neurons of the substantia nigra pars compacta. B. Accumulation of beta-amyloid plaques in the cerebral cortex. C. Cortical atrophy in the frontal lobe. D. Presence of Lewy bodies in the substantia nigra. A.E. Loss of acetylcholine-producing neurons in the basal forebrain. Answer and explanation. Correct answer. A. Loss of dopaminergic neurons of the substantia nigra pars compacta. This patient is presenting with classic symptoms of Parkinson disease, which is characterized by resting tremor, bradykinesia, slowness of movement, rigidity, often cogwheel, postural instability, e.g., shuffling gait, masked facies, reduced facial expressiveness. The pathophysiology of Parkinson disease involves degeneration of dopaminergic neurons in the substantia nigra pars compacta, which leads to a dopamine deficiency in the striatum, caudate, and putamen. This impairs the normal functioning of the basal ganglia circuitry, resulting in motor symptoms such as tremor, rigidity, and bradykinesia. Incorrect answers. B. Accumulation of beta-amyloid plaques in the cerebral cortex. This is characteristic of Alzheimer's disease, which primarily affects memory and cognition, not motor function. Cortical atrophy in the frontal lobe. This could be seen in frontotemporal dementia, Pick's disease, which often presents with behavioral changes and personality alterations, rather than motor symptoms. D. Presence of Lewy bodies in the substantia nigra. Lewy bodies are seen in Parkinson disease and Lewy body dementia. However, the key pathophysiological feature in Parkinson disease is the loss of dopaminergic neurons, not just the presence of Lewy bodies. E. Loss of acetylcholine-producing neurons in the basal forebrain. This is associated with Alzheimer's disease, which leads to memory deficits and cognitive impairment, rather than the motor symptoms seen in Parkinson disease. Key learning points. Parkinson disease, pathophysiology, degeneration of dopaminergic neurons in the substantia nigra pars compacta, leading to reduced dopamine in the striatum and impaired basal ganglia function. Motor symptoms, resting tremor, rigidity, bradykinesia, and postural instability. Cognitive decline. In later stages, some patients may experience mild cognitive impairment or dementia. Management. Treatment often involves dopaminergic therapy, e.g., levodopa, dopamine agonists, and deep brain stimulation in advanced cases. Would you like to